see your list of cities that you are visiting and sharing PPE and other equipment, can you go over the process real quick about how we can get those supplies in the Central Virginia, Lynchburg, Roanoke market? And then on sidebar, as we move forward, looking back, you know, your decisions will probably be documented in a grand scheme at some point. What have you learned most about Virginians, and is there anything that you have done or the team has done that you look back now and say, I wish I had done that differently?
Andre, I love your questions, and I'm going to do my best to answer. The first is, and I appreciate this question because and it's in regards to how do we get the message out in this question to Central Virginia with PPE, that we're going to be in communities with testing. And that's something that we have really worked on, especially in the last couple of weeks. We're actually reaching out to our legislators. They are in contact with their constituents. We're reaching out to our leaders, VACO, VML, local officials, and also asking for the help of the media and the press, whether it be on a radio station or the TV, to announce when we're going to be in an area, because it doesn't do any good if we're there and then nobody knows about it. And so that's something that we have actually put a lot of emphasis on, and I think that's going well. There's always room for improvement, but it's very important that people know we're going to be in their neighborhoods, that they can sign up, and also that they know that you know, we encourage anyone that's having symptoms, obviously, to be tested. But if someone is living with a you know, a vulnerable loved one that is at risk and is concerned about that, we encourage them to come out and be tested as well. So as long as we have the supplies, we won't turn anybody away. The second part of your question, yes. Absolutely.
Just what is the process? Let's say Lynchburg, Roanoke wants your team to come out.
Yes.
And test.
Yes. If the question is if say a certain locality wants us to be in their area testing, they would notify us, Andrew. We would work with our Virginia Department of Health. They're working in conjunction with Dr. Remley, who's also working with our Secretary of Veterans Affairs, who oversees the Guard. So all of that together, the request would come in and then say, by all means, we would do everything that we can to get that area to do the testing. And also, if they need PPE, the same process, to let us know, and we'll help to get PPE to them. The second part of your question was, what have I learned about Virginians? You know, we have about 8.5 million Virginians that I oversee, and I have learned that we live in the best state, in the best country. I think what I'm so proud of, most proud of, is that at the beginning of this, we really encouraged Virginians to follow our guidelines, to flatten that curve so that we could maintain what equipment, what testing we had, so that we could maintain our surge capacity in Virginia, and they've allowed us to do that. And here we are, Andre, now 2 months down the road from when this first started, and now we certainly are trying to do everything that we can to keep people from getting sick, to keep people from going in the hospital, but our supplies are better, our testing capabilities are better, our hospitals are better equipped. So if someone contracts COVID-19 today versus 2 months ago, their outcome is going to be far better. And so I'm proud of Virginians for living during a very difficult time, following our guidelines, and just working together to put this health crisis behind us.
What would you have done differently? Or have all your decisions kind of been on the money?
On the money, Andre. No, I appreciate the question. You know, Andre, it's a novel virus. We've learned something new every day. It's probably maybe not the best analogy, but this is like a novel, if you will, and every day has a chapter or two that's new, and I only wish that I knew how that last chapter would read, and I don't know that, and we don't know that, and that's why you know, people need to be patient and continue to follow our guidelines. We look at data rather than dates, and that's what we'll continue to do as we move forward.